With that, I'm going to invite Dr. Veeral Ajmera. He has been a partner in crime over the last 6 years. He's Associate Professor of Medicine and also the Medical Director for Liver Transplant who works on biomarkers of NASH in our NAFLD Research Center. Veeral?
Great. Thank you, Rohit, and thank you all for attending today. 6 years ago, when I approached Rohit about a job here, there was something that he said that really resonated with me, which was that we're going to do research that changes the way that people practice medicine and care for patients. And that's what we've been doing together over the last 6 years, and I'm excited to share some of the studies that many of you have been involved in and which will change the way that we practice medicine for patients with non-alcoholic fatty liver disease. So we know that there are many risk factors that are associated with non-alcoholic fatty liver disease, and these include obesity, high blood pressure or hypertension, abnormal cholesterol, type 2 diabetes, and a family history or underlying genetics. And what we've tried to do is to complete studies that help us understand what is the risk if you have one of these conditions, and how can we identify you early before the liver accumulates too much damage to alter the trajectory of your liver disease and prevent complications. Let's see. Okay, so many years ago, actually, before I joined, this group performed a pilot study in patients with type 2 diabetes to quantify what percentage of patients with type 2 diabetes have non-alcoholic fatty liver disease, and importantly, what percentage have advanced scarring in the liver, so stage 3 or stage 4 scarring, and are at risk for future complications of their liver disease. And they utilized the most advanced non-invasive techniques that were pioneered here and elsewhere to quantify the risk in patients, and they identified that in patients with type 2 diabetes, 2/3 of them had fatty liver disease, and 7% had advanced scarring in the liver. When they looked at this a little bit closer, they identified that older patients had a much higher rate of advanced fibrosis in the liver. So the patients that were 65 and older, 13% of them had that advanced scarring that puts them at risk for complications of liver disease. But what we also know is that in 2018, the practice guidelines for liver doctors and providers suggested that we do not screen patients with diabetes for non-alcoholic fatty liver disease due to some uncertainty about what's the best way to screen those patients, what are the treatment options, and what will be the benefit to that patient population. So this team embarked on a larger study, and we recently are presenting these results at the liver meeting, and they're pending future publication. What we did was we enrolled over 500 patients to date with type 2 diabetes who are aged 50 years or older, and we performed a research examination where patients underwent lab tests, a clinical assessment, and the most advanced non-invasive imaging techniques to quantify the amount of fat in the liver and the amount of scar tissue. And this is what we found. We confirmed that approximately 2/3 of the patients with type 2 diabetes had non-alcoholic fatty liver disease. But importantly, in this older group of patients with type 2 diabetes, 14% had advanced scarring in the liver, and 6% actually had cirrhosis, so the end-stage amount of scarring in the liver. We also identified 3 patients that had a very early stage liver or gallbladder cancer through this study. So demonstrating the value of identifying this early by systematic screening of patients with type 2 diabetes. We also went on to evaluate in this group, what if you have obesity and type 2 diabetes? How does that impact your risk? What we found was that obesity amplified the risk of having advanced fibrosis or that advanced scarring in the liver up to 18%. So this is a large part of our population in the United States that has type 2 diabetes and other risk factors that may benefit from future screening for non-alcoholic fatty liver disease and fibrosis. What we know is that 80 to 90% of people with non-alcoholic fatty liver disease are either overweight or obese, and some of these patients who are not overweight may have some abdominal fat distribution combined with a high genetic risk for non-alcoholic fatty liver disease. We know, and we'll hear more from Dr. Tinkopa next, that patients with non-alcoholic fatty liver disease benefit from weight loss. But I want to share with you one other innovative study that we collaborated on with a group from Harvard, where we looked at genetic risk of liver disease. And these bars I'll walk you through. The blue bars are patients with the very highest genetic risk, and the black bars are those that just have a more normal genetic risk for liver disease. What we found was that the risk of cirrhosis is related to two main exposures in this population: weight and alcohol intake. But I think the promising information that we have here is that if you're able to limit alcohol intake and control your weight or your body mass index, the risk in the high genetic risk population of cirrhosis was similar to those who had a lower genetic risk. So genetics are certainly important, but they can be counterbalanced with a healthy lifestyle, and in the future, hopefully more therapeutics as well. But as we see, with increased alcohol intake and increased weight, the risk of cirrhosis goes up substantially. So with that, I'd like to just wrap up with a few concluding statements. Non-alcoholic fatty liver disease affects a third of the population. Only a subset of people develop advanced liver disease, but we know certain high-risk populations have been identified, including people with obesity or type 2 diabetes. And really the research completed at UC San Diego at this NAFLD Research Center with participants from the San Diego community will change the way that we practice as liver providers, and in the future support screening for non-alcoholic fatty liver disease and liver fibrosis to identify disease in an early state when we can alter the trajectory. Okay, thank you.